Hi, thank you for tuning into this presentation about Maryland's Home Visiting Accountability Act. This is Jennifer Bistrak with the Governor's Office for Children. There are two goals for today's webinar. One is to present information about the Home Visiting Accountability Act of 2012, and the second is to discuss the statewide data collection process that Maryland is about to embark on for all home visiting programs that are funded with state monies. So let's get started. You may be familiar with the Home Visiting Accountability Act of 2012, so this may be a review for you, or this may be fairly new information. So this act was passed a couple years back and included a few mandates for the state of Maryland. The first is that all programs that were funded with state monies, or 75% of the programs funded with state monies, are required to convert to evidence-based programs. The other 25% are allowed to be promising practices, which are those that are under review for evidence proving their effectiveness in certain outcomes for home visiting. The second mandate from the Home Visiting Accountability Act of 2012 involves data collection. So all programs that are funded with state money or funded with federal dollars that are passed through the state, as is done with the McVie program through Department of Health and Mental Hygiene, and various programs that are funded through federal funds passed through MSDE, are all required to report on standard measures. So we're going to talk a little bit about these standard measures. We're going to take a look at what the standard measures are, and then we'll take a look at how we converted the standard measures into a statewide data collection tool. So first, at some point after the development of this home visiting statute, a work group was convened on behalf of the Children's Cabinet. So the work group was comprised of members from various state agencies, comprised of members from various home visiting vendors, and members of the research community from Johns Hopkins, members of the Maryland Family Network, the Family League, and some county and Baltimore City home visiting representatives. So this group got together along with the Institute for Innovation and Implementation from the School of Social Work at University of Maryland, Baltimore, and determined what home visiting programs are already measuring, what the models already required programs to measure, and what standard measures might be cross-cutting across Maryland's various evidence-based models. Technical assistance for developing Maryland's standard measures for home visiting was provided by the Pew Charitable Trusts, as they have a national vested interest in the power of home visiting. So after much work from the work group and from the Institute for Innovation and Implementation, standard measures were approved by the Children's Cabinet just recently in March of 2012. So I do want to show you what these standard measures look like. The standard measures stretch across 5 general domains of children and family health. The first domain is child health. The second domain is maternal mental health. The third is typical child development. Then children's special needs. And finally, relationships. So as you can see, anywhere from 1 to 4 standard measures were selected across these 5 different domains. Excuse me. So I want to talk a little bit about the process, what happened after these standard measures were developed. I do want to take just a moment to pause and say that there's a copy of this presentation that's available on the Governor's Office for Children website under home visiting. You can there are a lot of resources there, and I'll take you to that website in just a moment so you can see where to locate other resources. Also, My contact information, as well as the contact information of a few other folks involved in home visiting at the state level, can be found at the end of this webinar. So I'll leave that slide up as soon as we get to it. And if you have any questions whatsoever about the legislation or the data collection process, you can feel free to contact us. So to get back to the data collection process and how things evolved after the legislation was put in place. After the standard measures were approved, the Institute for Innovation and Implementation created a data dictionary to help define each of those standard measures. From the data dictionary, the work group reconvened to develop a data collection tool, and there were great pains taken to ensure that questions were worded in a way that is most accessible to the vendors and the local management boards and the local health departments who will be utilizing this data collection tool. So the work group finalized the data collection tool, which we're also calling the survey, in November of 2014. Implementation for a trial run of our data collection process is about to take place, and we will be taking a look at program data for the first and second quarters of fiscal year 15. So we're very interested in your data from July 1 through December 31 of 2014. And data is due to be submitted through our electronic process by February 6th, 2015. Of course, we will always accept your data earlier if available. So I want to go through with you what the data tool looks like and also what the process for data collection is. As I mentioned, the data collection tool is available as an online tool, but we are offering a hard copy of the tool that you can access so that you can collect data through the hard copy, and then when you're ready to submit things online, you can access the online tool. So without further ado, I'm going to take you to the Governor's Office for Children website. So this website, the general website for the Governor's Office for Children is goc.maryland.gov. And if you go a little bit further and you add the /initiatives, this will take you to a website that goes through the various initiatives in the Governor's Office for Children. So if you scroll down this page, you'll get to the Home Visiting Initiative. And at the very end, if you click here, under Home Visiting, you'll see a page that specifically addresses Maryland's home visiting statute and fiscal year 15 data collection. On this website, just to provide a little orientation, you'll see a link to the online survey. So I'll just click there. This is a survey methods tool, and you'll be able to click through the survey on this tool. You'll notice that there are drop-down menus on this tool, and there's an opportunity to save and resume. So if you begin filling out the survey but you're not able to complete it, you can save and resume and go back to it when you have the opportunity. So I'm going to go back to our website and click out of this. This is the Governor's Office for Children website again. You'll see here that there's a hard copy of the tool, and we're going to be going through the hard copy in just a moment. In fact, we'll be going through question by question just to make sure that the language is as clear as possible. On the website, my contact information is here should you have the need for any technical assistance or any questions regarding the statewide data collection process. We have an archived version of the webinar here, so if anyone else in your organization and in your jurisdiction needs some information about this webinar, they can watch it here. You'll also see a link to the PowerPoint presentation that you're watching. This is a frequently asked questions document regarding some of the questions that our vendors had for us regarding this data collection process. And this is a link to the home visiting qualitative template. We know that numbers don't always tell the whole story, so we're asking for qualitative information too, whether that's a vignette or whether there is a family that has really benefited from home visiting during this reporting period of July 1st through December 31st. So there might be a family that has stood out as really benefiting from your services, and we would love to know so that we can communicate that to our governor and to the state legislature to really illustrate the value of home visiting. Okay, so the qualitative information is not mandated. This is above, so if you would like to provide us with that information either using the template, or if you'd like to provide us with that information and you want to just dictate your story to me, I'd be happy to take that. My contact information is on there. Okay, we will come back to that. I just want to flash to this contact information page. So you'll see contact information for Kim Malott with the Governor's Office for Children, Mary Lacasse with the Department of Health and Mental Hygiene. My contact information is here, as is Nancy Barobes with MSDE. So if you have any questions about this data collection process, you can get in touch with any one of us and we'll be happy to assist you. With that, I'm going to go back to the Governor's Office for Children website. Down to home visiting, I'm going to click this link here. And I'm going to click on hard copy. So right now, what I'd like to do is go through the data collection tool. There are 40 questions on the tool. I just briefly want to touch on each one of the questions and hopefully make this data collection process as easy as possible. Okay. All right. So starting at the beginning of this tool, we ask for your jurisdiction. This is a jurisdiction by jurisdiction tool. So if you have a program that is a multi-county program, please complete a new tool for each county. So you'll see a drop-down menu and you can select one county. We would like to be able to break data down by each county. Number 2, please provide the complete contact information on the appropriate contact person in case I have any questions about your data. Who would that contact person be? So please fill that out. Number 3, you're going to see a drop-down menu where you're asked to select which evidence-based home visiting model are you using. There are also some non-evidence-based models like Healthy Start, or you can select other and type in which model of home visiting you're using. Maybe you're providing home visiting without a model, and we want to know that too. So you'll have an opportunity to fill in the other category. The next couple questions ask about funding sources. Question number 4 asks you to indicate what percentage of funds your program receives from each type of agency: federal, state, local governments, nonprofit, or other. This question does require that the calculation adds up to 100% before you can move on. Question number 5 asks for more detail on the federal sources of funding. So what are those federal sources of funding you receive? If you don't receive federal funding, you just click Not Applicable. Question number 6 asks about state sources of funding. So please check the sources of state funding that you receive. If you don't receive state funding, click Not Applicable. And if your source of state funding is not listed, please click Other. Question number 7 is asking about nonprofit or other sources. So just type in what are those other sources of non-governmental funding that you receive. And if you don't receive any other, you would just type into one of those sources not applicable. One note on all of these funding questions, we do want to know the original source. So maybe you're a vendor and you get money through the local management board. If you're filling out the survey, please check in with the local management board to find out what your original source of funding is, as opposed to just writing local management board. All right. The next set of questions, we're asking for more details about the program and demographics about the families served by your program. Numbers 8 and 9 deal with the capacity of your program. So number 8, what's the total capacity that this program is funded to serve during this reporting period? The reporting period again is July 1st through December 31st of 2014. So your first and second quarters. So number 8 is the total capacity that you're funded to serve. Number 9, what's the weighted capacity of this program during this reporting period, with weighted capacity defined as the number of families the program can serve based on the level of clients and the frequency of their home visits. We understand that weighted capacity is a dynamic number, so we're asking what the weighted capacity is as of the end of the reporting period. Number 10, what's the total number of women served by the program during this reporting period? And that is both mothers and expectant mothers. Number 11, please record the number of mothers and expectant mothers in each age group served during this reporting period. And it is their status as of the last day of the reporting period. So you see some age breakdowns there, and these are age breakdowns that overlap with Maryland vital statistics. So in the chart that you'll have, you'll be able to enter numbers for mothers, women who have already delivered, and mothers who are still in their prenatal period. Number 12 asks about the race and ethnicity of the mothers during this reporting period. So you would just put how many mothers are fit into each category, and there is a category for not specified. Okay, the next set of questions are similar to those about mothers, and these we're asking about the target children served by your program during this reporting period. So number 13 is how many target children were served by the program during this reporting period. Number 14 asks about the numbers in each age group. So there are just 3 age groups in this reporting period. So how many children fall into each age group? Number 15 is race and ethnicity of children, of the target children. So a couple notes here. Target children are those children who are enrolled in the program. They are not other children in the home who are not enrolled. So there are other children who may be benefiting from the program but may not be officially enrolled. So please do not count those children in the survey. One other note that I meant to make earlier: if your agency conducts several home visiting programs, maybe you run an Early Head Start program and you run a Healthy Families program and you may run a HIPPY program, please fill out a different survey tool for each program. So each tool represents, each completed tool represents a single jurisdiction and a single program model run through that jurisdiction. So maybe this is a Healthy Families program in Calvert County. Okay. We have a section of 3 questions which solicits information about primary caregivers other than mom. So it came to our attention in developing the survey that a lot of our home visiting programs serve dads as a primary caregiver, or maybe grandmom as the primary caregiver, or some other family member, or perhaps the child is in foster care. So perhaps your primary caregiver is a foster mom or dad. Use the next 3 questions to provide information on primary caregivers other than mom. Note, this is the only section to report information about primary caregivers other than mom. So in question number 16, how many of the following were enrolled as a primary caregiver during this reporting period? So you would indicate how many fathers, how many grandmothers, and so on and so forth. Question number 17, what services does this program provide to the primary caregivers other than mom? Please select all that apply. So do you provide services exactly per the model and curriculum? Do you provide adapted services? Do you provide other services? Number 18 is an open-ended question. This is the first of many open-ended questions in the survey. Please add any additional comments that you have about primary caregivers other than mom that you think will be helpful to our statewide data collection process. Okay, we're moving on, and at this point, from this point forward, we're about halfway through the survey. Now we're really getting into those standard measures. Remember, the standard measures are child health, maternal mental health, and so on and so forth. So going in that order, we are beginning our questions regarding those standard measures, the first of which is child health. And the standard reporting measure for child health, determined by the Children's Cabinet, is in regards to child regularity with well child checkups. So this question number 19, what is the number of target children who have fully adhered to the well child checkup schedule recommended by the American Academy of Pediatrics while they've been enrolled in this program? You'll see below that the AAP well child checkup schedule is listed by 1 month, by 2 months, etc. And we're interested to know, since this child's been enrolled in their program, have they attended regular well child checkups? And you would write that number in the line below. If your program currently does not collect this data, you would write do not collect here, or DNC, or you could just put an X. You may enroll children later, so you may not have children since birth. So let's say you get a child at 6 months of age or 1 year of age. Then the question is, have they been attending well child checkups since they've been enrolled in your program? So you don't have to look retroactively or retrospectively. You can just start from whenever they enroll. In number 20, please indicate any reasons this program does not collect this data. So if you do not collect data on well child checkups, please indicate why you don't collect and what help you would need to begin collecting. So that takes care of the child health domain. Now we're going into the maternal mental health domain. And this is a larger section, as there are more standard measures. Question number 21. This is a chart that you'll fill out through the survey methods format, but for the hard copy it just looks like a static question. Please complete this chart with data on depressive symptoms for the expectant and postpartum mothers served in this program during the reporting period. Only count each woman once, even if multiple screenings were performed. Count a woman as screened positive for depression if she screened positive at any point during the reporting period. If the program does not collect this data, please indicate an X in the appropriate column. So the first question in this chart is, what is the number of women screened for depression? So you would write the number of women here, and if you don't collect this data, you would put an X here. The second part of this question, what is the number of women who screened positive for depression? So you would put that number here, and or you would place an X here depending on if you collect this data. What is the number of women who screened positive for depression who were then referred for services? You would put the number here or do not collect here. You would just put an X. All of these questions are asking about the number of women who were screened and referred during this reporting period. The fourth question is a little different. What is the number of women who either initiated mental health services during this reporting period or who continued mental health services during this reporting period? So a woman might have even enrolled in your program receiving mental health services, so she would still count here in this fourth part of the question. So what's the number of women who initiated or continued mental health services? You put that answer here or do not collect here. Number 22 is an open-ended question asking you to let us know, if you don't collect any of the above data, why don't you collect? What help would you need collecting? Number 23 is similarly formatted. This question is regarding substance use and substance abuse. The same parameters exist on this question. Only count each woman once, even if multiple screenings were performed. Count a woman as screened positive for substance use or abuse if she's screened positive at any point during this reporting period. If the program does not currently collect this data, place an X in the appropriate column. What is the number of women screened for substance use and abuse during this reporting period? What is the number of women who screened positive for use and abuse? Number 3, what is the number of women who screened positive who were then referred for services? Number 4, what is the number of women who either initiated substance use and abuse services or continued services during this reporting period? And number 24, please indicate all reasons this program does not collect the above data and what help you would need to begin collecting. Okay. Number 25, so we are still in the domain of maternal mental health for the next couple questions. Number 25 is asking about clinically high parenting stress. So we learned in the development of the survey tool that clinically high parenting stress can be measured by a number of different tools. Some of the tools that might be in use are the Parenting Stress Index tool, Healthy Families Parenting Inventory tool, the Life Skills Progression tool, and the program might use another tool. So we have an option for as measured by another tool here. So in this question, please fill in the following chart with information regarding clinically high parenting stress. Fill in only the column for the tool that is used by your program. If your program does not currently collect this data, place an X in the appropriate column, the do not measure column over here. Please count each woman only once, even if multiple screenings are administered with one client. Also, please count a mother as presenting high with parenting stress if she screened positive at any point during this period. So you would indicate what is the number of women you screened using the Parenting Stress Index tool, if that's the tool that was used. What's the number who were screened for clinically high parenting stress using the Healthy Families Parenting tool, if that's the tool that was used, and so on and so forth. In number 26, if you indicated that you use another tool to measure clinically high parenting stress, please indicate what that tool is in question number 26. And in number 27, please indicate the reasons that you don't collect any of the above data, if in fact you don't collect data on clinically high parenting stress. Okay. We're moving into the third domain, which is typical child development. So we have questions regarding screening for ASQ3, or with the ASQ3 tool, and with the ASQ SE tool. Question number 28 asks what the total number of children is that were screened for typical child development via the ASQ3 tool during this reporting period. So only during the period of July 1 through December 31. So you would indicate that number here in question number 28. How many children were screened via ASQ3? Question number 25. Of the children who were screened with the ASQ3 tool, please answer the following questions. What is the number of children who demonstrated atypical development as evidenced by a score below the cutoff? What is the number who demonstrated atypical development and were referred for services? What is the number who are currently receiving further services for atypical development? And in this receiving question, we're interested in all children who are currently receiving services, regardless of if they were referred during this period. So maybe they were referred prior to July 1st, but they're still receiving services for atypical development. Please count those children here. Questions 30 and 31 are the same questions, but in regards to the ASQ SE tool. So question number 30 asks how many children were screened using ASQ SE during this reporting period. And then in question number 31, what is the number who demonstrated atypical development as evidenced by a score above the cutoff using the ASQ SE? What is the number who demonstrated atypical development and were then referred for services? And what is the number who are currently receiving further services for atypical development? In question number 32, please indicate any reasons that this program does not currently collect data via either ASQ3 or ASQ SE. Moving on to the next domain of children's special needs. Number 33, there's just this one question with several parts here. Please fill in the chart with data on children referred to or receiving the following services for disabilities during this reporting period. We use a couple acronyms here. IEP is Individualized Education Plan. IFSP is Individualized Family Service Plan. So part one of this question, what is the number of children referred to the local school system child find office for Part B, preschool special education services, during this reporting period? The second part of this question, what is the number of children referred to the local infants and toddlers program for Part C, early intervention services? The third part of this question asks, what is the number of children receiving Part B? What is the number of children receiving Part C? And the last part of this question is, what is the number of children receiving private services for disabilities during this reporting period? We have one more section, one more domain under our standard measures, and that is the domain of relationships. So we have a handful of questions here in regards to relationships. The first set of questions is in regards to parenting behaviors and or parent-child relationships. So in number 34, we're asking, what is the total number of mothers assessed for parenting behaviors and or parent-child relationships at some initial baseline point? So that initial baseline point may or may not have been during this reporting period. If a mom has been with you for a year, you may have measured her at 6 months of enrollment, and now her child is 6 months old, and maybe you've remeasured her. Number 35, during this reporting period, how many women who had an initial parenting behavior screening were screened for follow-up on this measure? Number 36, how many mothers who were assessed at both baseline and follow-up showed improvement in their parenting behaviors or parent-child relationships? So this is for a mother who would have needed a baseline and assessment and a follow-up assessment, and of that population, how many women showed improvement. Number 37 is that open-ended question asking for you to indicate if there's a reason why you don't collect this data currently. Number 38 through 40 are in regards to domestic violence, or you may refer to it as intimate partner violence, so we just included both names here. Please indicate all time intervals at which home visiting staff screens for IPV or DV. So check all the boxes that apply, or if you don't screen for IPV or domestic violence, please indicate that. And if there's another interval, please check that box and indicate that. In number 39, we have a chart to provide more information about screening and referral and safety plans for intimate partner violence. Please fill in the chart with information regarding women who were screened for IPV and DV. If your program does not currently collect this information, please indicate that with DNC in the appropriate column. What is the number of women screened by 36 weeks gestation? What is the number who screened positive by 36 weeks gestation? They screened positive for intimate partner violence. What is the number of women who screened positive by 36 weeks gestation and completed safety plans within 24 hours? The next part of this question asks, what is the number of women who were screened at any other interval other than 36 weeks gestation? What is the number who screened positive at any other interval? And what is the number who screened positive and completed safety plans within 24 hours? So the first three parts of this question are all in reference to women who were screened at 36 weeks gestation. And the second half of this question regards women who were screened at all other intervals. So maybe they were screened at enrollment, maybe they're screened yearly, so please indicate that there. And the final question is an open-ended question asking you to let us know if you don't collect any of the above information on IPV or DV screening, what assistance would you need to begin collecting? So that concludes the data collection tool and the survey on statewide home visiting data collection. To flash this up again, this is my contact information, jennifer.biztrack@maryland.gov or 410-767-6255, or you can contact any of these other folks on the slide. The Maryland Governor's Office for Children website is where you can find resources about our data collection process. So you just go to the initiatives link, go down to home visiting and click the Here button, and you will have access to a hard copy of the survey. You also have access to the online survey. When you're ready to submit your data, you would go to the online survey. Thank you so much for tuning in, and thank you for taking the time to complete this data collection tool. The results of this tool will help us showcase the efforts of home visiting across Maryland through a single lens. We realized there are more than 60 home visiting programs and 5+ models that Maryland uses. So in order to compare apples to apples, we appreciate your data collection around these standard measures. Please call me with any questions, and I look forward to receiving your data. Much thanks. Bye.